Hi, I'm Michael Barrow, Tech Lead for MedECC.
Hello, I'm Dr. Shanlei Liu. I'm a general surgeon at the Mayo Clinic. COVID-19 has put an unprecedented amount of pressure on the medical system. As the number of people hospitalized with COVID continues to rise, the demand on medical personnel will be overwhelming.
The nature of the pandemic is that localized clusters or hotspots arise, such as the recent spike in New York. These surges put a great strain on local healthcare resources and can overwhelm the system, resulting in equipment and healthcare worker shortages.
Our solution to this problem is a telemedicine web application that can be used from any smartphone or computer with a camera and microphone. This application allows an interface for doctors and nurses to remotely monitor their patients, as well as allows bedside caregivers to quickly and efficiently escalate alerts through the medical chain of command. The core features of this application include live stream video from patients to physicians. This allows for physicians to quickly check in on their patients when they are not in the same location. Chat functionality, allowing caregivers to communicate directly with physicians regarding the status of their patients. Physician notes and checklists, providing a space for patient records and instructions for caregivers. A health hierarchy, which allows for simple escalation of concerns to the appropriate providers. And a shift change feature, allowing for one caregiver to pass their patient to the next caregiver at the end of their shift.
Hello and welcome to our live demo of our telemedicine application. Right now, you see our live stream of the patient, which is me at the current moment. As you can see right now on your right, there is also the caregiver's view, which has the same live stream. Now I'll show you our patient menu. So as you can see here, this is the patient menu, which includes a live feed and a QR code. And if you click on the QR code, there will be a QR code for the caregiver to scan. And next, we will go into caregiver's view to exchange messages between doctors and caregivers.
Now we can take a look at the messaging functionality within the application. First, on the left, you can see the caregiver's view, and on the right, you can see the physician's view. You can see here, we can exchange messages between the caregiver and the physician. And after caregiver taking a look at the patient, the doctor will give suggestions to what the caregiver is to do next. And as you can see here, the doctor will recommend the caregiver to follow the checklist instructions. After the doctor issues a checklist to the caregiver will be able to go through the items on the checklist. And as you can see here, if all of the checklist items not filled, the caregiver will not be able to proceed. And only when every item on the checklist is filled, then the caregiver is allowed to proceed back to patient details.
MedECC allows doctors to connect with patients instantly through their phones. This means patients can get better care whilst doctors limit exposure to COVID patients, keeping both patients and themselves safe. This is an unprecedented time of crisis, and we need to do what we can to protect our healthcare workers who are keeping us safe. MedECC can help.